Dr. Gupta, for the people that are watching this that are meeting you for the very first time, please introduce yourself.
My name is Aleea Gupta. I am originally from Georgetown. I was born in Georgetown, Guyana. My parents are both from Guyana. My mom's from Novar, Maiconi, and my dad is from Georgetown also. I am a family physician, and that's what I do nowadays, and most specifically, I am a direct primary care physician, which is a model where I don't take insurance, but I provide medical care largely to people who don't have insurance, which is a big thing here in the United States. Insurance is very expensive, and so there are millions and millions of people who don't have any health care, and they just can't afford it. So I worked in many different places as a family doctor in my career, and from day one, I thought, this is just too busy. Medicine is too busy. This is not the way what I thought I would be doing. I love being a doctor. I've always wanted to be a doctor, but this is not what I thought. It's too fast, and you have to rush. You don't have enough time with people, and overwhelm was like the predominant theme the whole way through. And I'm in my mid-50s, so I worked in different places, and I just always thought something was wrong. Something is wrong. It's not supposed to be done like this, but what choice do I have? And then when I was in my mid-40s, I found out that there's a concept called direct primary care, and it's a private practice with a low fee where patients can see you as many times as they want, and they pay that low monthly fee to get care from you. And then they get their labs and medicines at a lower price point. And I thought, oh my gosh, not only am I getting to help the community, but I'm getting to have more time with people, because I can see fewer people in a day, spend more time with them, take care of, instead of thousands of patients, more on the number of hundreds, and really look after them the way that I want to. So that's what I'm doing now. That's kind of how I started. It was obviously back in Georgetown, but there is a lot in between, so I'm happy to fill that in as well.
As a Guyanese-American healthcare professional, how has your identity shaped the way in which you approach patient care and communication?
So I have a unique Guyanese identity in the sense that I was born in Guyana. I lived there for a few years when I was little, and then my dad decided that he was going to take us all around the world. So we lived in London, we lived in Jamaica, but the bulk of my years were in Saudi Arabia and in Iraq. And we were there because opportunities at that time in Guyana were not great for teachers, which is what both my parents are. And at the time, the Middle East was paying very well and hiring people from overseas to teach English to college students. So my dad decided that's what we were going to do. And so he moved us to the Middle East, and I spent 10 years of my childhood between Saudi Arabia and Iraq, and Dad was teaching. And then when I was in my teens, we got our green cards to move to the US and moved here. So the end result of all that is that I literally moved about every 4 years of my childhood and met people from all sorts of places. But my Guyanese identity was always something of a challenge because I didn't grow up and live in my country. But one thing that was great was the jobs that Dad had would pay for us to travel all the way back to Guyana every summer. And we would stop in New York and London and Miami, and then eventually get to Guyana and spend maybe like a month or so, and then make our way back to Saudi Arabia or Iraq. And because of that, every summer I saw my aunts, my uncles, my cousins, and I got to have a summer in Guyana. So I got to live there, but I can't navigate my way around very well, right? Because then I didn't learn to drive, and I've never driven there, but I definitely associate Guyana with my family, right? My cousins, my aunts and uncles. And how that translates to me as a healthcare professional and a physician is that I had to move so much that I learned how to connect with people very quickly. I also was only rarely around someone like myself. I was always with other people, different nationality, and the schools in the Middle East, at least the ones I went to, were very mixed. So it wasn't like there were all these groups and I wasn't part of it because I was Guyanese and non-Saudi. No, there were people from Egypt and Lebanon and Syria and Pakistan and all mixed up. So I just got used to being around different kinds of people than myself. And it used to bother me when I was younger because I thought, well, I don't know, am I Guyanese enough? What am I really? But I know that's what I am inherently, but I also know that I feel very much like a world citizen. And, that translates to patient care because it makes it very easy to connect with people from all sorts of backgrounds, which is what we have here in the United States.
Many people that are from immigrant communities, they view doctors through a lens of hierarchy. And as someone who's traveled the world, you've probably seen that play out differently across the world. How do you approach patient care so that the patients feel open to speak with you and comfortable?
I think being a woman automatically starts you in a different place. At the time when I trained, which was in the 90s, was when I did my medical training, it was still what we call patriarchal back then. So not ideal, but the typical physician here in the United States was an older white male, and that's who our attendings were. And the representation within medical schools was still just approaching 50-50 male-female. And now I believe it's higher on the female end than the male. But more than that, the landscape of who's training you and who's in medicine has changed because there are so many of us that are now representing different types of people. So how that relates to me and patients and coming up in medicine with that traditional view of the hierarchy is, I think I just didn't pay it very much mind. I was very lucky that the places where I worked were very diverse. I worked in an academic institution first, and we had, younger women, younger men, older men, African American, Latino. This was in Los Angeles, so very mixed, right? And then I went to an HMO practice, which again, the head of our department was an older white man, but then the rest of us were from all over the place. So I think because I have trained and worked around so many different types of doctors, I didn't really think too much about it, and I wasn't trying to climb the ladder either. If you're trying to advance and become a leader or somebody that's at the top, it might be a different story. But for me, I always was working, taking care of patients, and when you're taking care of patients most of the time, it's just you and them, right? They come in and they check in everything, but then they're there to see you in a space just like this, and that's what the medical care is. So in that sense, it becomes more of a partnership. And I never thought of it as a hierarchy in the sense that I am somewhat higher than my patient. I've always just thought I'm here to partner with you and educate you. Educate you is always the first thing in my mind. It's not even tell you what to do. It's educate you about your health.
I saw a post on social media where you spoke about your grandmother's literacy level, and you clearly articulated that a person with limited literacy is limited in their ability to access resources in society. How do you see health literacy playing a role in patient outcomes?
This has been studied and this has been discussed in the medical literature. There's a huge impact of literacy level, socioeconomic status, education on health outcomes. And it's just been represented, it's been shown in multiple communities time and time again. When I think about it, I'm not sure exactly what leads to what, whether it is economic and there's a different level of access just to medical care to begin with, whether it's not being able to understand as much about medicine, and that translates to being able to express what's wrong to your physician, understand what they recommend, follow through with what they suggest for you. By contrast, now in the age of AI and patients who have access to more materials and more information are bringing that in with them, and sometimes it's a challenge because it can be overwhelming, and then there are misconceptions, and then you're weeding out what's true and what isn't. but they are far more able to advocate for themselves. They're able to question. They're able to look things up on their own. They're able to decide, is this right for me or not? And I feel that if you lack that literacy or you're held back a bit, you are more timid, and your experience at the physician is different, and perhaps you're intimidated by, the education, the learning, and all these other things coming at you. I would envision that if, for a patient who's struggling with literacy. So I absolutely think it affects your ability to manage your own health care, and then that indirectly affects the outcomes as well.
So for people who might feel intimidated, who might feel insecure in the practice or in interacting with a physician, what are some ways or tips that you can provide to them to feel a little bit more confident when they are communicating with their healthcare providers?
So the first thing I would say is bring somebody with you if you can, because two people are always better than one. And when you're not familiar in a medical setting and you're the one experiencing the symptoms, it's difficult to retain what's coming at you because you have fears about the experience, fears about what's wrong with me, fears about what am I going to have to do, the cost, the time. All of that is the emotional side that you bring to the visit. So having another person with you that can just help gather that information and keep it all and take it out with you is helpful. So if you have that opportunity to bring somebody with you, I would say number one. The second is definitely to make a list. And this is so hard on doctors because the list can be very long. But from the patient perspective, bring a list of everything that is on your mind, especially if it's your first visit and you're just meeting a new doctor. But with every visit, what are you coming in for? Am I just coming in for a checkup for you to tell me what I need to do? Am I worried because I've been experiencing this, and this? Is it a bit of both? Have I done this and now I'm worse or I'm better? Whatever the reason is, bring that to the table because that is your way to advocate for your health. And the third is to actually understand the setting that you're coming into, because I think understanding having an expectation, understanding of what can happen in the visit is actually to your benefit. I think most patients come in thinking, I'm going to present these 10 problems and I'm going to leave with 10 solutions. And that is an unrealistic expectation. It really is. It's kind of like going in for, a haircut and you're like, by the way, I also need my eyes done, my eyebrows done, my nails done, and my pedicure done in the same amount of time, mind you. Now what's going to happen? None of those are going to be done well. But if you had just gone in for the haircut, she could have cut your hair really well. And it's kind of the same scenario. You can bring the list, but don't expect that the list is all going to be handled in one visit. Patients have to take time off to come to the doctor. They have to pay to come for a separate visit, but you cannot address more than at most 2 to 3 things properly. And you have to understand that if you want more than that, it's not going to be addressed properly. It just isn't, because it comes back to that same metaphor. Can you do 5 things that you would do at the salon in the same time? No. Everybody understands you're going to have a bad haircut if you try to do that. And the same thing applies in healthcare. And so being able to understand that I can have 1 to 3 things done well takes the pressure off of you and the person you're seeing, the physician. And then we'll get to those other things another time. I think those 3 things are the most important, and if you're able to do that, it will change the visit, and you'll come away feeling a lot more satisfied.
Many immigrant communities, stigma is a huge barrier to care. Do you as a physician see patients come in and they are still afraid to speak about certain stigmatized issues as it relates to their health?
I do. I think that has been, and for many people continues to be, a difficulty, especially if you're first generation or you're newly moved to the U.S. With every generation, our cultural inheritance changes, right? But with the first generation, you're walking that line between, I want to hold on to new things, I don't want to give all that up, but I'm here now and I want to be comfortable. And, there's a a delicate balance between the two for that first generation. The generations after, it changes, it morphs and it evolves, and their view of their culture is different than the ones who brought the culture here. But that stigma is there in the sense that there's a fear of physicians here in the US. They may be a different model and a different setup from quote unquote back home, right? Language is different, accents are different, ethnicity is different, socioeconomic. So the person across from you may or may not have as much in common with you as they did when you saw somebody back home, right? So I think people worry that, when they go to the doctor, they're going to be judged. And then there are some really deep-seated fears that are just part of different cultures. One of the big ones, and I see it in more than one ethnic group, is this worry that if you go to the hospital, you're not coming out. I've heard this so many times over the years. People worry if they go there, they're never going to leave because they know somebody who went to the hospital and died. So that connection is there, and I think it gets discussed and I think it gets handed down. But of course, as a physician, I'm on the other side of science. I have worked in the hospital. I've been there on codes. My husband's a surgeon. So we are about fixing, right? We're fixers. And I'm like, okay, we can't fix it here in the clinic. You have to go to the hospital and get your blood sugar lowered, or you need surgery because you've got cancer, or you're bleeding in the wrong place and we need to do a procedure. So we're sending you there to fix it because I can't fix it here. And so trying to deconstruct that and explain that, yes, people die in the hospital, but that's not the intention and that's not the major outcome. The vast majority of people get better and come back home because what they were there for would have really harmed them otherwise. You don't go to the hospital unless nobody else can manage it out here. You just don't, right? You only get admitted if what you have is higher level and needs an inpatient doctor's care. So you wouldn't be going there unless you needed that type of care. And so trying to get them to understand that and work around the fear so that the right health care can happen.
What would you say to someone who is intimidated by a physician? As a physician speaking to a patient, what would you say to them to encourage them to go in, get checked out, and to have honest conversations?
I would say that communication is at the heart of the doctor-patient relationship, and communication is your path to getting the best health care. It's intimidating because there isn't a lot of time, and in many settings, it's busy. But believe it or not, the physician seeing you, they want to give you the best that they can. They want to get to the bottom of your solution. And even if it's a short amount of time, they want to get to it and help you, right? So to that end, the best thing you can do is communicate your concerns. So after you've gone through the discussion of, I'm bleeding and we need to go to the hospital to get this checked out and this and that, explain to the doctor, I'm really worried.
When you think about healthcare, what gives you hope right now as it relates to trust and community care and the model of healthcare itself?
What gives me hope is that there are people and there are physicians who are going into their communities and creating practices like mine. I didn't know this type of practice was possible, or I didn't know anything about it until I started looking around in my mid-40s. And I wish I would have known about it earlier and that I could have started a little earlier. One side of it is having more time with your patients, which is life-changing, and not having to see as many patients. But the bulk of my patients don't have insurance, and I've learned so much about how you can access better health care without insurance. Not just part of this practice, but just the cash pay options for people. So that gives me hope because I know that physicians who are able to provide this type of care are filling a huge gap in our nationwide community and giving health care to people who otherwise have very fragmented health care. If you think about it, if you have no insurance, what do? You avoid going to see a physician because you're worried about the cost. Let's say you go in and you're diagnosed with something where you go to the emergency room, then there's no follow-up. right? Someone found out you have high blood pressure, high cholesterol, diabetes, but then you're afraid to go back to someone else because now you're going to have to pay again. So things are found, then there's no follow-up, right? And then what you're charged at the ER or what you're charged at immediate care is so much higher than a membership to a direct primary care practice. So to give you an example, most practices base their fees on age, and so younger people pay less than older people, but there's a nationwide cap, so the highest you can pay in a direct primary care is $150 a month as a senior. So think about it, for $90 a month in my practice, which is my under 30 age group, patients can see me as many times as they want, they can call me, text me, they get labs at cash pay, so an annual panel is, which is like, I don't know, 10 different labs is about $60, $70. That panel, if you go to get it as a cash pay, is going to be, I don't know, $500, $600. The other day, a patient came back and said, my labs were $1,000. The same thing you ordered at cash, they accidentally billed me directly, and it was literally, no, $1,100 for labs that in my practice are $70. So you get cheap labs, you can get medications at cost, you can have x-rays and MRIs at cash, but this doesn't take care of, it's not insurance, right? So if you have to go to the ER or something like that, it doesn't cover that, but it gives you primary care. And so people can have their pap smear, they can come in when they have a sore throat, they have a rash, diabetes medication, even GLP-1s nowadays. So I'm excited because I like saving my patients money, and I don't want anyone to overspend on healthcare, but I also want people to have quality healthcare. So I feel like this space is providing some of that, and the only thing is many people don't know about it, and not, I think there are probably like maybe about 3,000 practices in the States, but younger doctors are interested, and more specialists are offering cash pay sides, cardiology. If you don't have insurance, I can still send you to the cardiologist and you pay per visit, right? But it's still, seeing a cardiologist twice a year and paying $300 each time is still less than buying Blue Cross for $1,200 and you haven't even used it, right? It's $1,200 just to have it. And then we're not talking about the deductible and copays and all that. So being able to help contribute to affordable health care, that makes me excited and that makes me hopeful, because it's shifting healthcare back to where it belongs, which is the focus being on the patient and the person who's taking care of them.
It's been fantastic being here in Chicago, where you getting to sit and learn about your Guyanese roots and your well-rounded background of being a global thinker and how that has impacted the way in which you approach healthcare and patient care. I wonder, do you have any last words for the viewers?
My last words would be great healthcare exists here. I can only speak for the United States because that's where I'm working and where I live. But you should be able to find somebody to look after you that doesn't judge you, that appreciates where you came from and meets you halfway. Believe it or not, most physicians, when they're taking care of somebody, are really busy thinking of the medical side of what's going on. We don't care whether you shaved your legs. Most of the time, we just don't have time to think about those external factors that might make a person feel judged, because you're very busy trying to piece together the puzzle of what's happening with what they're expressing and how do I fix that? How do I check it? What am I, how do I make sure it's not cancer? How do I, help convince them to start this medication, because without it, they're going to decline. And you're so busy doing that there isn't as much time, I think, to worry about where's the person from, what are they wearing, and have a bad feeling about that. And that's at least the way I practice. So I think knowing that perhaps when you're in that encounter, what your physician is thinking is not nearly what you expect. And then that affordable health care definitely exists here in the United States. If you ever want to know anything about direct primary care, I always talk about it on social media, but certainly just looking for direct primary care near me will lead you to things in your community. It's a great option if you don't have insurance, but even people with insurance who feel like they don't have time at the doctor, the visits are too rushed, can still join a practice for the same low fee just to have a direct primary care doctor, but use their insurance for their labs and their meds and seeing a specialist, but they still get to have that slower experience, with a doctor who's not as busy. So.
Okay. Dr. Gupta, thank you so much for your time today.
Thank you for having me. This was just so fantastic.
Amazing.